My name's Dr. Rosemary Higgins. I'm a health psychologist. That's a psychologist who specialises in working with and treating and researching in the area of health. I've worked for the Australian Centre for Heart Health for 25 or more years, and I'm running and working there a cardiac counselling clinic. For young people with heart disease, especially when you're starting to become an individual, starting to separate more from your family, there will be that tension between that feeling of safety and feeling of being controlled. You do not want to feel like you are your disease. When you're unwell, it's hard for others and even yourself to see beyond that. Your experiences in your life have shaped you to make you grow up earlier, to make you more aware, to change your perspective. Now, other people won't understand that life can't be taken for granted or isn't as simple. One of the most important things is connectedness. Connection with your community, connection with your family, connection with your friends, connection with your passion, with what matters to you. When people have anxiety, one of our major ways of managing that is what we call exposure. It's facing the fears. It's talking and acknowledging them and safely facing fears. Make space for the fact that you will have difficult thoughts, difficult feelings, uncomfortable sensations, and making space for that, not fighting it, but allowing it to be there, and then seeing if we can spread our attention. This can also be a useful springboard for gratitude. For people who've been through a lot in their life, they may not get post-traumatic stress disorder, they may get post-traumatic growth, which is a sort of a wisdom that's earlier than its years, an appreciation of life, of self, of beauty, of connection. Sometimes you have a really complicated relationship with your body, and when you may have many scars, that can make the relationship even more complex. I'd really love you to be able to think of those scars as the story of your strength. You can give as much of the story of your scars as you want. They don't define you, they're part of you. In relationships, it's important to be curious and to understand that the other person will be curious. So being ready to give a little bit of yourself, being ready to share some of your story, but also be curious about what the other person's story is. It's all about fairness and being interested in the other person's story as much as they're interested in yours. Contact your local HeartKids. There's a real program of camps and events. They're not just aimed at parents, these are aimed at the children as well. There's a real therapeutic bond in meeting someone in the same boat. They get you, they'll know that what you've been through and you'll know what they've been through. For other young people, they might want more formal psychological support. See what works for you. Even talking just to your local GP, that can be enough for some people, or talking to a teacher or a counsellor at the school. Just try and see how it goes. I think one of the things to remember is that difference doesn't mean defectiveness. Just because you have a difference doesn't mean you're defective. And connection is liberating for the soul, for the heart, for the mind, for the psyche. As you can start to talk about your experience, it can really assist with managing stress, trauma, and difficult emotions.